Hello, PA Scholars. Welcome to the online lecture for the PA Scholars Program. I'm Dr. Cosby, and if you were here with us face to face, then you also had the opportunity to meet Dr. Dana Stanhope, who is the PA Program Director. But today, this online lecture will just be given by me. I will be walking through each of the slides and really talking through all of the requirements to remain in the PA Scholars Program. So first and foremost, I wanted to introduce you all to two women that you probably all have either interacted with or will interact with at some point in time during your enrollment in the PA Scholars Program. So that's Dr. Stanhope. She is the Department Chair and Program Director of the Department of Physician Assistant Education. She has been our program director since the inception of the PA program and was responsible and instrumental in creating the PA program here at Point Loma Nazarene University. In the middle, this is the woman that you all interact with the most. This is Tara Bowles. She's our department assistant. I happen to call her boss lady. She is the person who keeps us organized and is truly the kind of point person for all of you students in the PA Scholars Program. She is the individual that you will send most of your documentation to, and also the individual who keeps track of, let's say, things like your grades in certain prerequisite courses, or your clinical hours. So if you have any questions about the PA Scholars Program, I would suggest starting with Tara Bowles. And I'm Dr. Cosby. I'm the interim chair, so I get the privilege of leading you through this online lecture this year, but Dr. Brandon Sawyer is the point faculty member for the PA Scholars Program here at Point Loma Nazarene University. So first and foremost, congratulations, PA Scholars, for making it through your first semester in the PA Scholars Program. We know that that is not an easy feat, so we wanted to just spend a few seconds congratulating you. At the bottom of the screen, we'll also send the slides. You can visit our webpage for the PA Scholars Program to make sure you have a great and in-depth understanding of the PA Scholar Program prerequisites and requirements to stay in the PA Scholars Program while you're here at Point Loma. The list is very long, and I think Dr. Sawyer and I would both say that this process is your process. So we want you to take responsibility for knowing all of the requirements, and our job as faculty members is really to hold your hand and walk with you through the process, but certainly it is your responsibility to make sure you own all of the things that are required for you to stay in our PA Scholars Program here at Point Loma. So what is the PA Scholars Program? It's an exclusive opportunity for freshmen, so first-time freshmen, to be guaranteed a position into PLNU's Physician Assistant Program upon graduation. And so there are three specific majors that we've targeted on our campus that we've identified really make up the bulk of students who are interested in becoming physician assistants, and that is our applied health science major, our biology, either BA or BS major, and our biochemistry majors. So if you are a student in the PA Scholars Program and you fall outside of those majors, please speak to us, but I think we have all verified that all of you fall into one of these three categories. Again, for more information on the PA Scholars Pathway, please do not hesitate to click this link below. It'll take you to our Physician Assistant Program requirements and then also link you to our PA Scholars Program. So in terms of what's required to actually get into the PA Scholars Program, you must have had a cumulative high school GPA of 3.75. You must have completed at least 3 years of math, high school math and science, but we recommend 4 years because we find that you're more successful in the science and math courses that you're required to take while you're in the PA Scholars Program. You must have had a minimum official test score of one of the following, either a 28 composite ACT with no subsections below 23, or a 1300 composite SAT score, math plus evidence-based reading and writing. So I'm assuming you all had at least a 28 composite ACT score or a 1300 composite SAT score, and that's why you're still in the PA Scholars Program. You must have submitted 2 letters of recommendation by December 1st to Tara Bowles. And then you must be in one of the 3 approved majors. So if we were to go back a slide, that applied health science, the biology, and biochemistry majors. And it appears that you all are in those approved majors. And then last but definitely not least, you must have completed and submitted an online PA Scholars application, and all of those materials must have been turned in by December 1st. So those transcripts, those ACT and SAT scores, those letters of recommendation, all to Tara Bowl so she can confirm that you meet the starting requirements for the PA Scholars Program. Now that you've completed the application, the next step is, what do you need to do to stay in the program? So just like coming into the program, you must have had a minimum cumulative GPA of 3.75. You must also maintain that 3.7 cumulative GPA throughout your 4 years here at Point Loma. In addition to maintaining that 3.75 cumulative GPA, you must have a B or better in all of our prerequisite courses. So Chemistry 1 and 2, which would be the equivalent of Chemistry 1052 and 1053 here, our Organic Chemistry 1 and 2, which would be the equivalent of 2094 and 2096. Anatomy and Physiology, which for our Applied Health Science majors is written into the 4-year academic plan, but for our biology and our biochemistry majors is not. So you'll work with your academic advisor to figure out when that fits best in your actual curriculum, but that would be Bio 1030 and 1040 with the lab. Cell biology and biochemistry, which would be Bio 2010. Microbiology, which would be Bio 2020, or you could take 3015, your choice. Statistics of some sort, advanced biochemistry, and genetics. So you must have Bs in each of these classes listed below. If you do not, that then reduces your chances of staying in the PA Scholars Program. In addition to that, you must choose at least one of the following elective courses. So that is Pathology of Injury and Illness, which is Kin 3085, the Physiology of Exercise, which is Kin 3040, Assessment of Lower Extremity Pathology, which would be Kin 3087, or Assessment of Head, Spinal, and Upper Extremity Pathology, which is Kin 3088. If you're a kinesiology major or applied health science major, then you're already required to take the first 2 courses. So the recommendation is to choose one of the assessment courses as one of your upper division electives. If you are biochem or biology, choose any of the 4. I think I could argue one way or another for all 4 of the classes. They're all very exciting classes. These 2 are going to be more hands-on, but these 2 certainly, if you're interested in like disease-based kind of pathologies, or if you're interested in maybe going into dermatology, that Pathology of Injury and Illness would be a great class to take. If you're interested in working with obese patients or going into cardiology, I'd recommend the Physiology of Exercise. And if you're interested in maybe going into orthopedic sports medicine and doing a lot of assessment and surgery, then I'd recommend these lower 2 courses, which are assessment. So if you like the lower extremity or the lower limb, I'd take Assessment of Lower Extremity Pathology. If you like, head, spine, and the shoulder, then I'd recommend taking the Assessment of Head, Spinal, and Upper Extremity Pathology. So you can see how it really depends on which career path in PA you choose to go into. But these 4 classes, all of them are great. All of them are taught by great professors. Now, one area where we see students needing probably the most help is in the paid direct patient care hour requirements. We get a lot of questions about what are the requirements, what things count as paid direct patient care hours. So I want to spend a little bit more time on this slide than any other slide in this online lecture. So let's talk about the requirements to stay in the actual PA Scholars Program. First and foremost, every student must have 100 hours by August 1st after their sophomore year. So you go freshman year, fall, summer, spring. You go sophomore year, fall, spring, summer, and at the end of the summer of your sophomore year, by August 1st, you must have completed 100 paid direct patient care hours. And then by the end of your junior year, you must have completed 250 hours. By the end of your senior year, you must have at least 500 paid direct patient care hours. Now, a lot of the questions really arise from what are some of the areas or what are some of the certifications that I can get to get those paid direct patient care hours. So this is not a all-inclusive list, but certainly a list of things or positions that students have held to get their paid direct patient care hours, and they include being a nurse, occupational therapist, a physician, a physical therapy aide, a CNA, an occupational therapist aide, or a nursing aide. Those are all any of these aid positions, as long as they're paid, allow us to know that you're getting like paid direct. And when we say direct, we mean you're actually interacting, you have your hands on patients, you're working with them, right? Or you could certainly become a physical therapy assistant, occupational therapy assistant, or a medical assistant. We've built in, at least in kinesiology, we have created an EMT course, which is offered most often in the fall, sometimes in the spring. It's an 8-unit EMT course, which would allow you to sit for your boards and become an EMT basic. And so you can work as an EMT basic. Some of you are already EMT intermediates or paramedics, but these would all be positions that you can hold to get paid direct patient care hours. You can work as an athletic trainer, a corpsman. If you were a part of the military, that will count as direct paid patient hours. Patient care tech, research assistant with patient encounters would be a good one. Scribe is where we see a lot of students usually working, so scribing for a physician, a phlebotomist, which doesn't take very long to get your certification, an imaging technologist, or a dietitian. Again, this list isn't all inclusive, but certainly these are probably the top areas and the easiest certs to kind of get those paid direct patient care hours. You must document those. Oftentimes students ask us, like, how do we keep track? And most students will create some type of Word document, which will have one column for the date, one column for the type of patient encounters, one column for the number of hours that you spent during that particular day interacting with patients, and then a signature column for the physician or physician assistant or PT or OT or healthcare practitioner that was observing you during that time. And so you'll take that, you'll print and take that to every clinical encounter, have that signed, and then when you're done with those 100 hours, you will submit that in PDF form to Tara Bowles. What we really want you to do is really to start coming up with your plan to get hours now. I know oftentimes you're like, oh, 100 hours, that's no big deal, but really finding 100 hours of paid direct patient care hours can actually be pretty challenging. So one thing that I said in the beginning of this online lecture, and I want to say it here, is this is your responsibility. We aren't going to find you a job per se. We certainly can maybe work to help connect you or give you recommendations on places that have taken our students, but it is your job to hit the ground and to do the cold calling, to get the certifications, to get those paid direct patient care hours. Tara will typically send you a reminder email to let you know that those patient care hours are going to be due. But again, the biggest thing is they must be paid. And when I asked why for the paid part, was because we know that if they're paid, you're actually interacting with patients versus observational hours where you aren't actually interacting with patients. Again, this is one of the reasons that we see students leaving the PA Scholars program or being dropped from the PA Scholars program. It's because they don't have that 100 hours by the end of their sophomore year. Other requirements to stay in the program: you must attend 2 PA information sessions, one in March, which we just did, or you're doing now by sitting through this information session, and then a second session between September of your junior year and November of your senior year to kind of get you prepared for the interview process and the application process for the actual PA program here at Point Loma. You'll attend a PLNU PA interview session during January or February of junior year at PLNU. Again, this is to prepare you for the interview into the program. Any additional PA program activities as communicated via the PA program, its faculty or the program director. And then in addition to that, PA Scholars will be required to complete the online central application service for a physician assistant. So you'll have to still submit the application in CAPSPA and a supplemental application. So even though you're guaranteed admittance into the program, you still have to go through the full application process as if you were an external student, right? What this does is it ensures students are captured in the national database for PA programs. You will have to pay the current CAPSA rate, so you still have to pay the application fee as well as the supplemental rate and application fee. In addition, admission to the PA program for all incoming PA students is contingent on clearance of a criminal background, a negative drug screen, and compliance with the immunization requirements. And so should you have any questions about these specific requirements, if you click this link, it will link you to the PA Student Handbook, which will tell you all of the immunization requirements, all of the other requirements of students applying to the program. So in essence, you're still treated like the normal PA student applying to our program. The difference is, as long as you pass a background check, as long as you have a negative drug screen, as long as you are in compliance with the immunization requirements, and as long as you complete the interview and pay your application fees, you're guaranteed admittance, right? And so you can take a deep breath. We know that applying to PA schools is very competitive. So if you get to this point in the process, we congratulate you. Job well done, and one less stressor for you as you get ready to graduate. So creating your 4-year plan. Applied Health Science majors, you're going to use the pre-PA 4-year plan and checklist, the Applied Health Science checklist. Make sure that you add Chemistry 2096 second semester of your junior year. Make sure you're adding that upper division biochemistry, which is 4050 senior year. And then make sure all of your other required courses for the PA program, along with just the classes required to graduate, are included in your 4-year plan. I guess what we're saying here is, at least for Applied Health Science majors, is make sure you have everything laid out. Make sure you understand when you're supposed to be taking things, because certain classes are only offered in fall semester and or spring semester. Again, this is one of those areas where I say this is really your responsibility to own your 4-year plan. As academic advisors, we're going to walk with you, but we certainly want you to own your own 4-year plan. If you're biology and chemistry majors, you will need to plan to take Bio 1030 and 1040 by the junior year. Most of the kinesiology majors take it in their sophomore year, so if it fits in your 4-year plan to do that, that would be great. The reason why we recommend taking that Bio 1030 and 1040 by your junior year is because all of those upper division, let's go back, all of those upper division kinesiology courses that we require you to choose from have anatomy and physiology as a prerequisite course. So we want to make sure that you have the prerequisites that you need to add that upper division elective. Make sure all of the other courses are included in your 4-year plan. So just like we say to the kinesiology majors, we want to say it to our biology and chemistry majors as well. Make sure you own your 4-year plan. Make sure you know which classes are available in the fall and which ones are available in the spring. Of course, anatomy and physiology for bio and chemistry majors is going to be an added course to your 4-year plan. So make sure you're creating room and space for that course. And then last but not least, I want to encourage you to get involved. Dr. Sarah Chung is now the Pre-Allied Health Club advisor. She's been the advisor for years, but in addition to that, she is now the Pre-Allied Health advisor for all students across the campus. So that can be students in kinesiology, biochemistry, biology, right? And so make sure you look out for events from the Pre-Allied Health Club, and where you can attend, make sure you're attending. Make sure you join the PLNU PA Student Society as a non-voting member. You can find out how to join that on our PA website. And then watch for volunteer opportunities from the PA program. I can't tell you enough how often the undergrad students here at Point Loma get emails from our PA didactic coordinator looking for them to be patients for their current students. And that's a way for our PA faculty to get to know you. It's a way for you to start interacting with the PA students and to start asking questions about the PA program. And then it's also a way for you to see what's required of our students. So if you have the time and you receive volunteer opportunities from our PA faculty, definitely recommend you taking advantage of that. In addition to that, it allows you to get over to the Balboa campus, which is an amazing facility that oftentimes our undergraduate students just don't get to see. So you get to see where you're going to be living if you were to come to PLNU's PA program. So I'm going to move back a few slides to this slide here, and I'm going to end by saying, again, we want to congratulate you for making it this far in the PA Scholars Program based on the rigorous requirements. We know that this isn't an easy program to continue in, and so we want to congratulate you. The whole purpose of this online lecture is really to allow you all to remember that there are requirements that you have to maintain in order to continue to be a part of such an amazing, prestigious program such as the PA Scholars Program. If you have any questions while I'm interim chair, please do not hesitate to reach out to me. I'm going to move back a slide. My email is here. If you have questions about documents, please do not hesitate to reach out to Tara Bowles. And if you have direct questions about maybe direct paid patient hours that aren't on the list of items that I listed, then you can reach out to Dr. Stanhope. She welcomes that. But really, truly, any questions about the PA Scholars Program that isn't related to direct patient care hours, please start with Tara Bowles first, and she will most often be able to help you out. That concludes this online lecture. Please let us know if you have any questions.